Hi guys, so this is registered nurse Sylvia and no longer student nurse Sylvia. Clock it! So in today's session, I'm going to be teaching you how I was able to ace my council exam in just one sitting. So sit back and relax. Welcome back. So first of all, I'll explain the nature of the exam you're going to write. What do I mean by that? Like your council exam is going to consist of three papers. That's your paper one, paper two, and paper three. Your paper one is objective, your paper two is objective, and then your paper three is practical. That's your OSCE. The normal OSCE you do in your school, that's what will be done. So don't panic. Okay, so I'll dive into it. So nursing council exam is they actually have their question banks, where they get these questions from. And most times I'll encourage anyone, before you go to write your council exam, make sure you are well grounded in your past questions. Make sure you do past questions frequently. At least in a day you should do like have a target of like 100 to 200 questions in a day. Now, the questions you'll be seeing are it's not just nursing related. Trust me, you will see other questions like what you learned. It's going to comprise of what you learned starting from your year two, your year three, your year four for the BSc nurses. Yes, from your year two, year three, and your year four. That's what you'll be seeing. Questions you will see management, you will see um sociology, you will see different things. Trust me, you will see so many questions on not just nursing related, not just med surg and the rest. You will see from other courses that maybe you feel is that they are broad courses in your department. Okay, coming down to the practical session. Now the practical session just consists, what they'll be bringing out is also the same thing, like the practicals you've been doing from your year two, year three, year four. They can just decide to bring out any practical or any procedure for you. And if you don't know it,
You get it? If you don't get it, forget about it.
from the moment you've seen this video, you should make a list of the procedures you've done, starting from your year two down to your year four. You see those ones that are unique in their own ways that you don't really know. Those ones, that's the type that you have to like make sure that at least in a day you're able to like revise one procedure. Like, okay, even if you don't carry out the practical, maybe you're busy, just be able to say it out. Oh, okay, what's this procedure? Great, no, do the normal preambles, wash your hand, don your gloves. Just be able to say at least one procedure to yourself in a day, or two procedures to yourself in a day. At least say them if you're too busy to carry them out, like with your friends or your cliques. You get me? The next thing is how these questions are. Like, are these questions easy? Are these questions hard? I won't say they're easy, neither will I say they're hard. I feel they are just based on residual knowledge, like knowledge, things you've learned from your previous classes. So for those of you that read to pass, you will still meet it in council. So please start now. If you're in year two or year one watching this video, start now. At least read to understand. Read to understand is really going to help you, because some of these questions will come up in your council exam and you're expected to know it. The truth is that you cannot cover everything. You cannot cover everything in one semester, like everything that the whole scheme of work or curriculum for your nursing council in just one semester. So you should have known some things in your year two. You should have like residual knowledge of things you learned, so that when you're reading it again, you're just picking and you're just skimming through and picking the important things and all that. Then I will also encourage that you join channels. I'll recommend in my next video, I'm going to recommend the textbooks I use, some PDFs, and then some channels and YouTube videos I used for my exam to like rehearse. I also recommend some like past questions, question banks and all that. So stay tuned for my next video. I'll be posting and I'll be giving you guys update on it and how to go about the PDF and how to get it. Okay, so back to what I was saying. Please and please and please, residual knowledge, very very important. Read to understand. Read to understand, so you won't be shocked. Then for the practical session too, the project, please and please take your project seriously. I know that sometimes some students don't do their projects by themselves, but even if you don't do your project by yourself, please read your project. They will ask you questions on it. Read it like you did it by yourself. They will ask you questions on it. I'm not going to lie, they'll ask you questions, and if they ask you any question and you don't know it, it means that you're not the one that did the project, and that's an automatic fail for you for that project aspect, because your project and your OSCE, that's your practical side, is what makes up your paper 3. You get. They might also ask you questions from your RIN, that's your RIN. They might ask you questions from there. Wait, let me show you what the RIN is. Are you seeing it? They'll ask you questions. This thing you filled that they signed, that you signed by yourself. Yes. They will ask you. They can open it and be like, oh, really? So you signed that you did pap smear and uteral swab collection. So tell me about it. Tell me the procedure. I'm not joking. I'm not kidding, guys. Please, at least just at least have an idea. You mustn't read it, just have an idea, because they can open it and be like, okay, so you signed on this, meaning you did it. So what is this? They might even ask you something about community health, because community health is here. Then for the project, I'll be giving you questions that they might likely ask you for your project. I'll be giving you questions. That's in the next video that will be coming. Like subsequently, I'll be making more videos on this RN to write your exams. I'll be making more videos. So just stay tuned. This is just, I just want to like brief you guys on everything that I experienced. Then proper, my next video proper, we start the I start recommending what I use, and then I'll show you guys how to like plan out your timetable and how to go piece by bit to cover up everything. And then I'll also share you guys questions, like possible questions and all that, like and all that. I'll also recommend some things for you subsequently in my next video. So guys, this is just like the tip of the iceberg, and this is just like what you should expect and how you should face the upcoming council exam. And I wish you guys the best. I wish you guys luck. I can't wait for you guys to be my colleagues. All right, bye, student nurses. Have a nice day.